Yes, a very warm welcome to today's talk. And I love to say there have been a lot of very wonderful research that has been done on the potential of ivermectin, which is an antiparasitic drug, FDA approved for killing some parasites. Most so people have been using it on for treatment in farmlands, in eradicating some parasites in animals. But also it has been widely used in these communities in Uganda, most of the refugee hosting communities, in also fighting some parasites which can easily be ingested through the water which this community usually take. You know, it's a very marginalized community, so such cases are always there, and ivermectin is always available in the different households and the different village health teams provided to the different families. And it has been FDA approved for killing parasites, but there has been so much wonderful and very encouraging results and research that has shown its profound potential in killing cancer cells by the different means, especially apoptosis, whereby it directly kills the cancer cells, by more so working on the mitotic division of those cancer cells. So in the long run, a daily use of these drugs will kill the cancer cells and suppress the growth of these different cancer cells. And most beautiful news is that it treats various kinds of cancer which affects the different parts of the body. It has shown profound effect in curing and killing cells which are in breast cancers, esophageal cancers. Also, many cases have been used in cases of cervical cancer. So it's really so much important, and I'm very delightful for the coming researches, and it's very important to discuss this on this channel because this community will also benefit a lot from such very big developments in the health system, and it throughout the people who raise awareness about the importance of these drugs, because many people have labeled it as a very controversial drug more so in the Western world. It's not more of a prescription drug, and many doctors will not love to prescribe. We don't know why, and it's really so much absurd to this honorable profession if we cannot ask the maximum benefit of our patients. It's really very difficult to understand if you know that these researches are really so much true and has shown a profound effect in killing these cancer cells. So it can be a definite treatment for many cases of cancers. If at least something can be done, let's always do it according to we should maximize benefit to the patients. You know, in this refugee hosting community in northern Uganda, where I volunteer as a medical clinician, you find there's so much rising cases of cancer cases in the different localities, and these patients have really lost hope. Many are taken under a palliative care system, and even the relatives are so much stressed, coupled with the very difficult economic conditions of this community. It's really so much bad. The health facilities could not really offer a very significant amount of care to these cancer patients, and chemotherapy is very so much expensive and no one could even afford. So it's very difficult to really handle this in these communities, because and funny enough, you find they have a lot of these ivermectin drugs in in their houses, in their households. But because knowledge is really power, and they do not really have the opportunity of getting this sensible knowledge and also revealing the different researches that has been done, and also the right to use this drug is not really explained to them, so that you really find it hard for these patients to get these services of knowledge and the fruits of this research by very important people around the world. I've seen a lot of Dr. Marquis, who has really done a very wonderful work, and also Dr. John Campo for always putting this into the front line, and we keep on studying and also watching them to see how these big developments are progressing. We pray that it also leads to the betterment in the treatment of cancer in the whole world. So I'm speaking in perspective of the community where I stay. It's a very big refugee hosting community with a very difficult health challenges. So raising awareness about the importance of this ivermectin is really so much important, because I always think if something can be done to improve the health of your patient, it's really so much important. You find many of these cancer patients, the caretakers have given testimonies whereby their patients are told, their beloved one, they are told that the doctor tells you there's really nothing we can do. We just try to alleviate the pain and improving life day and day. But we are not going to treat this. Yet we have different treatments which could also work on this. So it's a big thing which we need to support the developments, and also try to raise the different awareness to see that people take the right to use these drugs. If they should be given a right to use, because it's really so much important to see progress in everyone. Then we build a lot of things together. So the sad thing is that many doctors do not take this seriously. I hope they will take it after these videos we're making the next video. Thanks.